Now, to ensure accessibility and affordability of essential drugs by consumers, the Federal Competition and Consumer Protection Commission, FCCPC, has commenced an inquiry into the high cost and variation in the prices of BP and diabetes drugs in different Nigerian markets. Speaking during a stakeholders engagement in Abuja, the Executive Vice Chairman of FCCPC, Tunji Bello, said the inquiry was to ensure better medication and healthcare delivery in the country. Bello, who was represented by the Director of Surveillance and Investigations, Ms. Bola Dale Adeyinka, stated that the move was also to ensure safety and guard against exploitation that could jeopardize the rights and welfare of the consumers.
The Commission received a lot of consumer complaints regarding the high cost and variation in the cost and price of the same drug in different markets. And this has given rise to the concern to understudy the market and bring up recommendations on how best to ensure that consumers can afford the essential drugs and also the same price applies to the same drug across our markets.
In the separate messages, the National Chairman, Association of Community Pharmacists of Nigeria, Eze Ambrosia, and FCT Chairman of Pharmaceutical Society of Nigeria, Salamatu Arakwelu, attributed poor infrastructure, drug importation, and lack of forex as some of the factors responsible for high cost and variation in the prices of drugs in the country.
Affordable medications and healthcare services in Nigeria.
In their separate messages, the National Chairman, Association of Community Pharmacists of Nigeria, Eze Ambrosia, and FCT Chairman of Pharmaceutical Society of Nigeria, Salamatu Orakwelu, attributed poor infrastructure, drug importation, and lack of forex as some of the factors responsible for high costs and variation in the prices of drugs in the country.
To ensuring equity, transparency, and sustainability in the pharmaceutical supply chain. Collaborative effort between policymakers, healthcare professionals, and industry players are crucial in tackling these challenges and safeguards patients' well-being. The PSN stands ready to support initiatives that promote price stability, enhance drug accessibility, and strengthen the NHIA for the benefit of all Nigerians. Together, we can build a healthcare system that truly serves the people.
Whenever we are talking about drug, we should also emphasize more on healthcare services. We should not be talking about the high cost of drug, but generally, considering the healthcare services. Because there's a lot of high costs of medical services are there. Generally, everything is very costly in Nigeria for a few days. So when we're talking about patients, we must also consider all the healthcare services generally.
The Commission further assured that it will continue to engage with necessary stakeholders towards protecting consumers from fake and substandard products and services across the nation.